we're going to get, if you all can hear me, we're going to get started. Welcome. Hopefully you have completed this little exercise Laura just gave you at the table, and as a chance to get to know each other at the table. One of the goals of this group, the Prenatal and Infant Care Network, is to have a chance to network and know others involved. Can I just start this accidentally?
That's okay.
What I'd like to do is officially welcome all of you guys. And I have a couple of really important people to acknowledge as we get started. First of all, as you're enjoying a delicious meal, I want you to think about Lutheran Health Network, because they are the ones who've generously sponsored this luncheon for us today. So we thank all of our friends there. Second, as we go through the program that's coming together, this is put together, we have a fabulous steering committee of partners who are very committed to the work of prenatal and infants in this community in a pretty large ways. And they have been meeting between these meetings to lay out what they think are quality programs that they're seeing in the field. And so I really want to take a moment and acknowledge all of those. And I'm going to ask you to either wave your hand, or if you're short like I am, please stand up. And so the advisory board for this group is with a Hope Center, Joe Faulkner. And then we have Allen County Children's Health Collaborative, formerly CHIP, and I'm not sure at this point if we have a representative at this moment with that group. Healthier Moms and Babies, Lutheran Health Network, Macmillan Health, Dr. Laura Overton, Parkview Health, St. Joe Community Health Foundation, and the Women's Care Center. So thank you to all of those and many others in this room who are continually contributing ideas on how we can move this discussion forward in the community.
I'm coming around.
Okay,
so.
Are the directories on the table? Are they on the?
No, they're back with Sharon.
Okay, look at the back where Sharon is waving these wonderful purple books. Kelly's waving some too. We are happy to share with you guys that after distributing 8,000 copies of the last year's directory, we have a brand new 2019 Healthcare Resource Directory focused on prenatal and infant care and all of the resources that you all have identified over the last year. New in this edition is particularly more information around what to do with your pregnant women clients who are struggling with addictions, mental health issues, etc., where resources in the community that has been added along with any other updates so we've gotten. Because the minute we go to press, somebody adds a new program. Please be sure to look at on there, you'll also see the link to the website. The website, Mark, who's back there in the burgundy sweater, is updating daily with any of the updates that you give us. So that is always real time, but you can't, when you need a paper book to give people, the book, we know there were 8,000 requests for it last year, so we know that that must be helpful to many people. So if you want to order them, they're free for you. We just need to know who needs and how many. Sharon is back there. Sharon, if you can stand up. Go see Sharon at any point. You can walk over, get an order form. She can help get you hooked up. Call us at the office if you can't, but it's easiest if you get Sharon today, so then we can follow up a little more quickly for you. So thank you for all your help. I believe everybody in this room should be featured in there to some degree. And if you're not, let Mark know. You'll be live on the website pretty quickly.
So we have to read these because the mic broke yesterday, so I can't take more out. Sorry.
All right, I hope you all printed very well. As Laura's suggesting that I need to read these, what you all came up with at the table. These are what people were said that their clients are most grateful for. So I think it is a helpful information piece. They're grateful for classes that we offer and that there is no cost for those classes. That applies to quite a few organizations in this room. At a Hope Center, they're very grateful for the free pregnancy test, the STI test, the Earn While You Learn shop, and the post-abortion recovery support group. Another group has put in there, they're very, very appreciative for education, support, encouragement. Meet them at their point of need and a sense of freedom. Next one said at the Department of Health, very grateful for the data that they are putting together to help build a community knowledge and understanding. And at the YWCA at Shelter, the case management and support there. Another one is spending time at visits and addressing more than the physical needs, which we'll be talking a lot about today. The next one is the emotional support, resource and advocacy, empowerment to be an advocate for themselves, that they don't just do it for them, that they're a part of making a plan.
Last but not least,
There we go. And the last one is appreciative for a new group that's joining the a lot of the work in the community called Young Lives, and they're mentoring people, starting at Northside High School, and they have a great summer camp program, and their connection, and I'm sorry, to support teens and pregnant moms is very effective. And they're grateful for teen moms and babies and the opportunity that they are presenting to share their lives with them. So I think that's a quick overview of many things we're gratitude for. And it's a perfect segue, actually. How many people have indicated that it's more than the material things? It's the environment, and I think everybody in this room probably knows that. But that's kind of the focus for today's discussions. I am pleased to introduce Holli Seabury, who is the CEO of Macmillan Health, and to talk more on this and some of her research around there. Now, as a bit of a to tell you at the front end, I talked to Holli about how to best introduce her. And this lady has accomplished so many, many things that I'd be reading a long page of paper. And she said, that will bore everyone. So instead, we have decided, and I have asked her, to please talk about herself and the work a little bit. So you're not to be too shy, please, Holli, because I want you to understand what a great resource she is and a blessing to this community.
Thank you. Well, that was already a great introduction. I'm not sure I need to do anything there. Yes, I work at Macmillan Health, and I'm not good at standing still at a podium, so I'm going to have to take this out. And two of my coworkers, Jen Story and Nicole Fairchild, are with me. The work I do involves a lot of graphics, and Jen gets to be in charge of that. You also have our handout on safe, stable, nurturing families on your table. So you're probably familiar with what Macmillan Health does, what we've done in the community for a really long time, which is teach preventive health education in the schools and to community groups. And we still do that. We've done that since 1981. We're still doing that. We taught 63,000 students last year. Here, most of them here regionally, but nationwide, because we have a green screen film studio where we do live distance education. So there is a great education department that handles that, and I stay out of it. What I do is work on developing resources, materials, and training for direct service providers who work with at-risk, predominantly low-income populations. And I work nationwide. Actually, we just finished up materials for a project in the Dominican Republic. But I work a lot nationwide with WIC, with Head Start, Help Me Grow, with a lot of groups like that. And we're going in and developing materials when they say they have a need that's not being met, that's health related. We just finished up a big project that we collaborated with our local Head Starts and some other local groups on. I see a couple of our, Mary Hess, Marlene Krause was on our committee. And that was for smoking-related, tobacco-related education to be used with families with young children and pregnant women. And that was actually a project with the Indiana State Department of Health. But that's rolling out, and it's free. So if anybody works with that population and is in need of training and educational resources, we're going to be, we have them now. So basically, I do a lot of different things. And I present at a lot of different conferences nationwide. In fact, the one place I rarely present, guess where that is? Fort Wayne. Yeah, I never present here. And over the past several years, because all of the work I do is about communicating with audiences who tend to live in stressful situations, which impairs their ability to learn, and how do we create materials that are really high impact with great graphics and low literacy, I've really talked a lot about chronic stress the last couple of years, and it's just been bad. It's like, this is chronic stress, it's bad, it's terrible, it does terrible things to people's brains. So I was thrilled when the CDC started coming out with this Safe, Stable, Nurturing Families framework and saying, here's a way that we can reverse this or stop this from happening. So that's what we're going to talk about today, but I'm going to give you a little bit of background, on chronic stress in case you haven't had any. We're going to talk about stress, and stress gets a bad rap, and stress doesn't necessarily have to be bad. We have a lot of positive stress in our lives. So we're asked to do a big work project, or we're getting ready to move to a new house. That's stressful, but it's positive, right? Then we have what's called tolerable stress in our lives. That's when something bad happens, but it's short term, and we've got people who can support us through that. So we have a family member who gets sick, or we lose our job. Yeah, it's bad, but we work through it, and people support us. Then we get into toxic stress. This is where the problems really start, and we're going to drill down a little bit onto what this is. But this is prolonged stress. We're activating the stress response system, and we don't have those protective relationships to help us through that. And this is where we start having some real problems. So what are the types of stressors that people face? Number one is poverty. Money cannot buy happiness. I know nobody believes that statement, but there's been enough research to back it up. Money can't buy happiness, but here's what it can buy you. It can buy you a huge reduction in chronic stress because it gives you what? Stable housing, stable food, stable transportation, medical care, mental health care. So money buys a lot of great things. So poverty is always our number one stressor. If we could fix poverty, we would fix almost everything. Drug and alcohol abuse, incarceration, mental illness, food, housing insecurity, emotional, physical abuse. We live in an unsafe environment, whether it's our house that's unsafe or a neighborhood that's unsafe. Somebody's ill, whether it's yourself or someone in your family going through a divorce. All of these things cause stress. And then there are those stressors that are unique to families. Some families have stressors that are just unique to them, but these are some common ones. And I do want to make sure, stress, while low-income people will have more stress because money does purchase a lot of stress reduction, higher income families can also experience a lot of stress. This graph shows the green is middle and higher income families, the blue is lower income families, and they measured the amount of stress that families were facing. So what we see with this green bar on number one is you see about half the higher income families facing one really bad stressor, right? They may be going through a divorce. They may have lost a job. Somebody may have alcohol or substance abuse issue in the house. But again, what we've learned is we can deal with that, right? We have supportive relationships, one stressor is okay. Where we get into real problems is when we get into 3, 4, and 5 stressors. 3 stressors or more is what's considered toxic stress. So if you line up those blue bars of our low-income families and you add them together, we see 50% of our low-income families are living in what we would consider toxic stress. So they're facing 3 or more stressors at a time. So let's think about that. I've lost my job, I'm facing losing my housing, and I don't have transportation. That's a lot to deal with, right? That's a lot to deal with at one time. So, again, this is prolonged, so it's not short-term. We're looking at prolonged stress, and we're looking at the absence of protective relationships to help us offset that. So, what happens? Well, when we're dealing with children, and sometimes I've had people say to me, oh, no, I only work with adults. I don't need to hear how this affects children. All my work is with adults. Guess what? Adults used to be children, every single one of them. So we really need to look back and see how children are impacted to understand how today's adults have been impacted, because we all grow up. Well, physically, we may not all act like adults, but we grow up physically. So what happens? So when we experience stress, our brains do a lot of things, but one of the things they do is they release a lot of the hormone cortisol. And cortisol is great if you need it. Say somebody jumps out and they're going to attack you, your brain is going to release a lot of cortisol, your body's going to release a lot of adrenaline. It is the fight or flight, and you're going to be able to, get away or shove somebody or do what you need to do, and it can be great. However, when your brain is releasing that all the time on a regular basis, it can be very detrimental to your brain, whether you're a child or an adult. It can actually, in children, change the physical structure of their brain, literally change how their brain is forming. That's scary. So this is a brain scan. On your left is a healthy brain. See how that's all lit up, the way a brain should be? On the right, we see a brain under chronic stress, and we see that we are not lighting up the way we should be in this brain. So it's actually impacting how that child's brain is working. So it impairs the way our brain circuits connect. Children who are under extreme amounts of stress can actually have smaller brains. Sustained high levels of cortisol can create lifetime damage to the hippocampus, which is learning and memory, and we're going to talk a little bit more about that. Cortisol also, in addition to the brain impacts, it suppresses the body's immune system. So we see these children just being sick a lot because they're living in a chronically stressful environment. So this is a measure of the brain differences, and this was between 5-year-olds. Where do you see the highest measure in difference? Language and memory. What do you need to succeed in school? Language and memory. So this is what I find really tragic, and why I focus so much on this work, is that we're setting these kids up by age 5 for a lifetime of failure, for a lifetime of not being able to succeed in school, not being able to succeed at work. And that's really what a lot of my work focuses on, is how do we prevent this? So when we look at toxic stress in adults and children, linked to over 50% of all absences, I started, my first job out of college was as a Head Start home visitor. I went on to become a supervisor for Help Me Grow in Ohio. And I was also the service coordinator for the county for what they call deep end kids, who are primarily teenagers. Dealt with a lot of no-shows, dealt with a lot of not showing up for appointments. Anybody who works in direct service, yeah, your heads are all nodding. And what's the most common reason you get? I was just too stressed out. I just couldn't do it. I just, I got up and I couldn't. That's legitimate. At the time it was really frustrating to me. It was like, what do you mean you couldn't get there? Or the mom we'd work with to get a job, And we'd worked and worked and worked, and we finally got her placed in employment, and a month later, we're talking to her, she's lost a job. Why'd you lose the job? Well, I didn't show up 7 days for work, and they fired me. Yeah, why didn't you show up? I just couldn't. I just was too stressed, I just couldn't do it. At the time, I was so frustrated. Now I understand how toxic stress impacts the brain. Impairs attention and concentration. This is huge. How many times are you talking to a parent and you're like, you're not paying attention at all to me? Like, I don't know what you're looking at, but it's not me and you're not paying attention. No, because there's a lot going on in their brain. There's a lot going on that they're thinking about what they're stressed about. And until we can deal with that, which is a different presentation on motivational interviewing, talking about how do we deal with what's going on so we can deal with what we need to deal with. But until we deal with what's really stressing them and help them through that, they're not going to be able to listen to what we have to say. Diminishes social skills and social judgment. If you go into direct service because you think all your clients are going to love you and thank you, you have gone into the wrong field, right? That is not going to happen on a regular basis. And that is because these brain changes diminish social judgment and social skills. And you see it a lot. Okay, you'll relate to this. Choice of boyfriends, right? Okay, you're nodding, you know. So you go into a home visit and there's a guy there who didn't used to be there and you're like, oh, so who's this? It's my new boyfriend. Who's not working, who just got out of jail, who appears to have a drug habit from the paraphernalia around the house. And you're like, why would you make this choice? But it diminishes your ability to make good judgments. Reduces motivation, determination, and effort. Yeah, you see a lot of that, right? Increases depression. 30% of our low-income individuals, it's estimated, are depressed. I would guess it might even be higher. And what's the problem with being low income and depressed? You probably don't have a lot of access to mental health care, right? And then this is the big one. It reduces the growth of new brain cells, neurogenesis. So when we have adult clients who are using substances that kill brain cells, and then they're in a situation where those don't regenerate too well, that's going to be a problem, isn't it? So these are so this is where, health effects of toxic stress on adults. As children get into adulthood, we see a lot of unplanned pregnancies. That's that ability to make good judgments. Heart disease, depression, drug abuse, alcoholism, addiction, suicide, tobacco use, liver disease, which is an outcrop of all the usage, and STIs. So we see a lot of bad, not just judgment and issues like that, but actual physical effects of toxic stress on the body. So that's where my talk used to end. Yeah, I was a fun speaker. I mean, I would come in and be like, well, this is horrible. You know, the only way I ever tried to offset that was, usually it was an intro to motivational interviewing, so it was sort of like, how can we communicate in a way that will help make this better? But I really had nothing to offer anybody. It was just like, yep, it's horrible. So now, thank goodness, we have something to offer. So what can we do? New research is showing that even under the most stressful of situations, supportive, responsive relationships with caring adults as early in life as possible can prevent or even reverse the damaging effects of the toxic stress response. Now, one of the things and I'll tell you how this came about. So one of the things we always knew was that there were kids in horrible situations, really, really terrible situations, that were okay. They were fine. They turned out okay. And they started looking at these kids and saying, why? You know, you should not have turned out okay. Why are you okay? And one of the things they started seeing was they had at least one adult who was there for them, who was providing that supportive, caring relationship. Hopefully it's a parent, doesn't have to be a parent, could be somebody else. You just need somebody there doing that. And then some kids are just amazingly resilient. There are some amazingly resilient kids who don't have that and they still turn out okay. So what do we need to do? We need to start early. We need to start prenatal. Ideally, we would start prenatal, preconception. Ideally, this would start preconception, but at the very least, prenatal or early infancy. So this is what drives me insane about the funding for Head Start. If I could take the funding for Head Start, I would flip-flop it and turn the majority of the funding to early Head Start, pregnancy through age 3, because that's where it's really needed, and that is really underfunded. The more we can be aware of the critical need to fund prenatal through, especially prenatal and those first-year programs, that's critical time. And we need to focus on developing those safe, stable, nurturing relationships. So we're going to talk about this. So this is what I call, well, it's not what I call, it's what they call a framework. And a framework is just kind of how you structure education. So when you have a degree in education, I know some of us in this room do, you learn that you need to work within a theory, work within a framework. And the theory I like to work in is social cognitive theory, Bandura's theory. And the reason I like it is because there's a lot in it about empowering people and role modeling for people. And then taking that theory, but putting it within the framework of safe, stable, nurturing families. And that's what we're going to talk about is that framework. So we have to understand, help parents and caregivers understand that their most important role is to keep their child safe, to give them a stable environment, and to nurture them. Okay, nurturing is the one we get hung up on. This is not the same as loving your child. Loving is a feeling, nurturing is an action. I was never involved in a child being removed from the home on my caseload for neglect or abuse where the parent did not say, but I love him so much. Yes, I believe that. However, you were not nurturing that child. So nurturing can be love in action, but it doesn't need to be. A lot of people nurture other people that they don't love. Nurses are a great example. Preschool teachers are a great example. They're very nurturing. It doesn't mean they love every single one of their patients. They may not even like a good number of their patients, but they have a nurturing job and they're professionals and they nurture their patients. There's some nurses in the room. I know you don't like all your patients, but you're still kind and nurturing to them, right? So this is what we have to help people understand, that it's not enough to love your child. Yeah, we want you to love your child, obviously. Nurturing is an action, not a feeling. You're not always going to feel that loving towards your child on a day-to-day basis, right? If they're being a total little snot, you're not going to feel as loving, but you still need to do the nurturing stuff. Okay, so here's what I love about this great graphic that Jen made. We've got this nice, happy, healthy-looking child in the middle, cute as a button, and because I work a lot in oral health, also very nice teeth. Very good oral health care going on here with this little one. But when we're working with people who have stressed brains, either they're currently stressed or they grew up in a very stressful situation and they're dealing with the impact of that as an adult, when we go to them and we say, I want to teach you how to be a good parent. Here's 5 million things you need to do to be a good parent. Whole bunch of things. You're going to need to do car seat safety. You're going to need to do this. And you're going to need to read to them. You're going to need to brush your teeth. And you're going to need to. I had a mom say to me, and this was a mom whose children had been removed from her care. And she said, I'm trying to be a good mom, but I don't know what it is I'm supposed to do. And every time I try to do something, it seems like there's more things I was supposed to do. What I really like about this is it's only 3 things. Even a stressed brain can grab onto 3 things. Keep them safe, keep your environment stable, nurture them. Now, are there a whole bunch of things that go under those 3 things? Heck yeah. But as long as you get those 3 things. So I got pregnant with my first child when I was 19. I'd actually never held a baby before I held my son for the first time. When I left the hospital with him, I said to the nurse, are you sure this is okay? Because I really did not know what I was doing. I had no family around. And Al Gore had not yet invented the internet, so I couldn't just get online and YouTube how to take care of a baby. So I was really lost, And I really wish I had had this, because man, I could have grabbed onto this. Okay, these are the 3 things I need to do. Got it, I'm gonna do these things. He survived, and is absolutely okay, but my life would have been a whole lot easier. So what is safety? So these definitions that I'm gonna read to you come from the CDC. So the extent to which a child is free from fear and secure from physical or psychological harm within their social and physical environment. So they're not just talking about safety as in, is the house child-proof, but they're also talking about, are you scared in the house? Now these are the list I made, which is just a few things that would fall under safety. Starting with prenatal care. We want to keep babies safe. What's the first thing we need to do? Good prenatal care, right? And then your basics, your car seats, your safe sleep. Are we in safe housing? Are the adults that you're being exposed to safe? That's a big one. New information out this morning about women and who is more likely to murder a woman. It's something like, it's ridiculous statistics, like 80% of women are murdered by an intimate partner or a close family member. Men, not as much, more likely acquaintances or strangers. But children, we know, is the same, that children are most in danger from somebody in the house. Is their childcare safe? Is there, if we're not in a safe environment, say there's domestic violence, is there a plan? If things get out of hand, do we have a plan? And then teaching parents how to talk, safe talk to their child. How to repeatedly tell their child, I will always keep you safe. I will always be here for you. I will always be looking out for you. It's really important. So stability, predictability and consistency in a child's social, emotional, and physical environment. So this is a big one. This is big. This is those things like, are we living in a stable household where we're staying in the same house every night? Are we going to bed? Do we have a bedtime? Do we actually even have a bedtime? Do we have a daily schedule? Do we know who's going to be around us? Do we know as a child when we get up every day what's going to happen? And that seems, unless you do direct service with families, who are really struggling, that seems like, well, of course you know every day what's going to happen when you get up. But that is not true for a lot of our children. They have no idea where they're going to go to bed that night. They have no idea who they're going to be around, what's going to happen to them. So how can we give them a stable environment with a regular schedule? I think this one, a lot of times, is the hardest one to accomplish, is stability. So, is our child care schedule, do we discipline? So discipline falls under stability. Do we discipline in a consistent way? If I knock over my glass of milk on Monday, is the same thing gonna happen as if I knock over my glass of milk on Tuesday? One day is mom gonna say, oh, no big deal. The next day is mom gonna hit me. So consistency and discipline is huge. Helping parents to have stable employment, moving, who's living in the house, having stability in who lives in the house. So a lot of people live where children are being cared for by 2 different family members, and that's okay. There can still be stability in that situation. There can be a lot of stability. If you know Monday through Friday I'm at mom's, at the weekend I'm at dad's, that's a stable situation, even though it's 2 different households. So nurturing. The extent to which a parent or caregiver is available and able to sensitively and consistently respond and meet the needs of their child. So I saw some really cool stuff on nurturing at a conference. It was out of, might have been the University of Maryland, and they were working with Head Start families, and they were videotaping how mothers responded to their children before and after they were taught about nurturing. And they showed the video of a mom, and her child was crawling across the floor. He hurt himself, kind of bumped himself, sat there, cried and cried. Mom kind of looked over at him, looked away. And then after going through, specific training on nurturing, they were filming again, and same thing happens. Now he's kind of toddling a little bit, and he bumps himself. Mom runs over, picks him up, holds him, rubs his back. So it was really neat to see, that it's completely possible to teach this, but it's extremely important to teach parents about how to nurture their children if they have not grown up in an environment where they already know that. And a lot of this people look at who grew up, in a really stable, good home environment, and you think to yourself, well, who doesn't know all this? Who doesn't know this? A lot of people don't know this. Because if they didn't grow up with it, they don't know it. So, can we provide physical affection with no strings? Not, I will hug you if. It's just, I will hug you. Do we comfort our child physically when they're upset or hurt? Do we quickly respond to their physical needs? I'm hungry. Okay, let's go in the kitchen. What would you like to eat? Not hours later, feeding. Quickly respond to emotional needs if they're upset. Encourage and praise. Okay, this is a big one, because if you've ever studied the word gap, and the word gap, I may have read a little too much about the word gap. The word gap, because now I can't explain it. The word gap is that lower income children, by and large, tend to hear a lot less words spoken in the home than higher income children. So when they start school, their vocabularies are a lot smaller, which impedes their success in school. But the other side of the word gap is not just that they hear less words, it's that the words they tend to hear are negative or harsh. So instead of hearing a lot of praise, they're hearing a lot of negative. Knock it off, don't do that, you're stupid, things like that. So it's really important to help parents understand that, yes, they need to talk to their children, but those words also need to be positive. Now, the reason I'm saying there's a lot of dispute about the word gap is the original word gap on how many words it is. There's been new research that says it's a lot of words, but it's not as many as they originally thought. Either way, our lower income children tend to start school with smaller vocabularies. And TV, and you all know this, not a good way to teach words. Because people think, well, I don't need to talk to them, the TV's on, they're hearing people talk all day. Yeah, that's not the same. They don't absorb those words in the same way. So do parents show the child they enjoy their company? I like being around you. And are they consistent? So this is a big thing that you see throughout this, consistency. So how do we do this? We've been given this really easy, good framework. I think it's easy anyway. It's a lot easier than anything else I've seen. And it's been shown to work. How do we implement it? Because if you look at what the CDC says are evidence-based programs for safe, stable, nurturing families, they list things such as Head Start and Nurse-Family Partnership. And then you go to Head Start, Nurse-Family Partnership, and they're like, I don't know what you're talking about. They haven't given us any curriculum on this. Now, are they an evidence-based program that shows that they work with families on these concepts? Absolutely, they do. But as far as organized curriculum around this, not so much. So here's how we don't do it. The literacy rates in this country are a lot lower than most people realize, unless you do direct service, in which case you're probably really well aware that they're really low. So you may have heard that in the United States we have a 99% literacy rate. We don't. The way they base those world statistics is on how many children complete elementary school. In America, elementary school is mandatory. About 99% of our children complete elementary school, so they assume we have a 99% literacy rate. We do not. I'm starting with the bright green on the right, about 13% of our population are really good readers, college, post-college readers, really good readers. Guess who the ones who create all the stuff for our low-level readers are? Yeah, those guys. That's why they tend to create really high-level stuff. About 44% of our population reads at about a 9th grade level. About 29% reads at about a 5th or 6th grade reading level. That's why if you write for Medicaid, you write Communications that are specifically for Medicaid insured individuals through insurance companies, you're not allowed to write them at more than a 6th grade reading level. That's one of the things I do a lot of, is work with insurance companies to edit their Medicaid materials. So I have a lot of fights with lawyers because they put in this language that's incomprehensible, and I'm trying to get it down to a 6th grade reading level, and they're trying to fight me and say, no, that's legal wording, it needs to stay the way it is. And I'm like, what are you trying to say here? And they're like, we're trying to say you can't commit fraud. Then just say you can't commit fraud. You know, let's just say that instead of these 5,000 words. 14% of our population is functionally illiterate. They cannot read and write well enough to absorb any information from written materials. If you don't think people graduate from high school who are functionally illiterate, I challenge you to teach a freshman community college class. I've done that, and a good portion of my class was functionally illiterate. So here's the problem. You add up 29 and 14, we've got almost half our population either reading below a 6th grade reading level or not really reading at all. That's a problem, because how do we like to communicate with people? Hey, we're in public health. There's nothing we love more than the trifold brochure, right? If you got a problem, I got a brochure. You know it's true. But how do people like to learn? They like to learn by having somebody tell them something and show them something. So if your child comes up to you and says, hey, I need to learn to tie my shoes, are you going to give them a trifold brochure on shoe tying? I hope not. Although some of us who work in public health might. No, what are you going to do? Give me your shoes, let me show you how to tie them. Let me walk you through it. Let me show you. That is how humans learn. It's how we have learned since the dawn of time. Show me, tell me, role model it for me. It's why I love social cognitive theory so much. So why is this so popular? Why is YouTube so popular? Because what do they do on YouTube? They show you, they tell you. If your washing machine breaks, which mine recently did, it was a major life trauma for me. My washing machine broke, and it was doing this thing where the water went in, but it didn't spin, so the water didn't go out. My husband went on YouTube. He found out, looked up our type of washing machine, looked up the problem, found a YouTube video that said it's probably a clogged filter, showed him how to take the front apart, pull out the filter, clean out, bam, my washing machine worked. He redeemed himself for his horrific habit of putting his shoes and socks in the corner of the bedroom instead of the closet. For at least a couple days, he was redeemed. So YouTube is popular. I mean, other than the idiocy of YouTube, you know, like my daughter loves to watch this really weird singer on there who's just goofy. And kittens. I mean, a lot of people like to watch kittens, which actually I'm okay with because that's a great stress reduction. So I'm all right with watching kittens on YouTube. But the vast majority of what we're watching on YouTube, a lot of us, is instruction, right? We're watching instructional videos. And 300 hours of video uploaded to YouTube every minute, 30 million people per day watching it. 80% of 18 to 49-year-olds will watch at least one YouTube video. That's in addition to all the Instagram, Facebook, and other video. And most of it's coming from mobile devices. So I am a huge advocate of video, short video, to teach people because they don't have to read. Now, you can give follow-up written information, but it shows them, it tells them. This is how we like to learn. So this quote is from Plato. I get a lot of flack for promoting video. I do, I get a lot of flack for it. So I like to bring up this quote. This discovery of yours will create forgetfulness in the learner's souls because they will not use their memories. They will trust the external written characters and not remember of themselves. He was very upset about a new development in education, thought it was going to ruin education. Can you guess what it was? These things. Yeah, Plato said we will ruin education if we start putting things in books. People will not remember. They will not memorize these long poems and stories. They'll just look in a book. Well, yeah, turned out that was okay, turned out that worked. I think we're going to see a dramatic shift in education, especially of our stressed populations, to try to move away from writing, try to move towards video, because it's just an easier way. This is our plan, which we'd like to start with moms with opioid use disorder as our first step, but all within that safe, stable, nurturing framework. I really like things that can be delivered through the phone, because every low-income person has a phone and they're on it all the time, as is every middle-income and higher-income person has a phone and they're on it all the time. So, and you may say, well, the state came out, God, I hope nobody's here from the state. The state came out with the Live app. Just use that. That is all writing, higher level, words, 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 words. So I want to have video, 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 but focusing on safety, stability, nurturing, earn badges, fill your house with your different badges, make it very visual and very easy to understand. So that's where we're moving. And I think I finished up just under the time, because my timer did not go off yet. And I will, oh yeah. So I will be back up, I have 2 minutes. I will be back up at the end for questions, so I'll just go ahead and give those 2 minutes on, so we have a little more time at the end for questions for everybody.
I want to just take a moment and everybody give another round of applause. I learned so much from you, Holly. You truly are a great resource. And maybe one of my convictions is for my first resolution for 2019 is I need to listen to Holli Seabury more locally and keep learning. So to complement everything she talked about, and I think particularly when we talk about that nurturing environment, we kind of have been coming at that at the St. Joe Community Health Foundation from a slightly different angle, but kind of landing up at the same place. This is the 20th year of the St. Joe Community Health Foundation. The sisters who sponsor us, the Poor Handmaids of Jesus Christ, have been in this community 150 years. And globally, they've had a tremendously positive impact of helping people in poverty rebuild their lives and have great, build meaningful lives. But they've always approached things mind, body, and spirit. And that's what they call their charism. And when we fund things, we look for ways to continue that charism, because we no longer have any poor handmaids actively living in this community. So 2 years ago, the board took this very seriously at the St. Joe Community Health Foundation and said, what are we doing about that spirit? What are we doing about that spiritual health? And we thought that's a great question. And so we've had a couple of agencies worked with us over the last 2 years, explore that a little bit further. When we say spiritual health, it's not religion. It's not whether, I think somebody once said to me when I said, what do you all do about spiritual health? They said, oh, we have a priest or a rabbi come and visit once a month or come through our location. That's great, but that's not really what we mean. We really mean, where's that emotional health? Where's the purpose? It's, I think Holly touched upon it, is that nurturing, what else is going on in that person's life? Are you, we can treat the broken bones, but if we haven't treated the heart at the same time, we're not getting people to going forward in their lives. And so we also realize there's not one formula. It's as different as everybody we have the opportunity to encounter and be with. So each agency should do this a little bit differently. 2 agencies, though, who've really worked hard on this have had a great experience, I think, with it, and have wonderful stories to tell that will help you all about how they learn to listen to the Spirit the emotional health, the emotional needs of their clients, how to ask the right questions. And as they did that, not only has it changed how they interact with their clients, but we've also challenged them to at least anecdotally collect data. Because what we have found is that almost everybody in this room can tell the stories of somebody whose life has been transformed. But when you can take that a step further and say, now this story is actually magnified because we've watched, when people came in the door, 30% of people were hopeful about their future. And after we've been with them for 6 months, 80% have hope. That's transformation as well as healing. That's what, so it's a journey that everybody's on, but we think we need to be mindful, and that's part of this whole safe, nurturing environment, safe, stable, nurturing environment. So I'm going to come up here now as a panel and have a couple of, we're going to have, in addition to Holli, who has a great deal of piece in this, we're asking Jo Faulkner from a Hope Center to come up and share her experience. And we're asking Libby Martin to come up from Lutheran Social Services with the ECHO program. And what I want to say and really applaud these guys because I think they'll all tell you that what they did the first time didn't work, and they had the courage to go back and say, this didn't work, let's try it again, and keep learning from the process. So I think that's a big part of the story too. So thank you for letting us learn with you. Now you guys, this gets a little bit tricky because you need to talk into 2 microphones. This one amplifies. If I put this maybe just here, see if that works or if you have to pass it. This one you need to pass because we are recording it. And what we have found out of each of these, about 50 people watch these sessions afterwards because they're small staffs and they can't all be here. So, Jo, if you would introduce your work, have Libby introduce hers.
Okay.
And then we'll kind of pass it on down.
Okay, I am Jo Faulkner, and I am with the Hope Center, and we take care of women who are facing unplanned pregnancies.
I am Libby Martin. I'm with Lutheran Social Services. We run our ECHO Teen Parenting, which stands for Education Creates Hope and Opportunity.
And I'm Holli Seabury. I think you got what I do.
I just wanted to start, if that's okay. I wanted to start, and the reason that I passed out the papers with the smiley faces, if you'll look at those, when St. Joe came to us the first time and told us, hey, why don't you guys start measuring spirituality? I thought, that's impossible. And then we sat down and we kind of hashed out, this is our first paper, and what we did was we decided that we would have our clients come in, answer these questions, and then 3 weeks later or 6 weeks later on their third appointment, we would have them come back and answer the same questions again. Now, one of the things that we push is that our clients have a relationship. That relationship is with an advocate. They'll see the nurse and do, the pregnancy test and all of that stuff. But we try to make sure that they see the same person every time. And the reason that we want them to see the same person every time is we want to create a relationship. Because we're not just there to give a pregnancy test, we're there to impact their lives. And so when we first started, this is what we used first. And then we decided, and if you have a chance, get with Janet Stevenson. She was amazing. We sat down and we talked about it. And so then the second set of questions you have are the ones that we are currently using. And so at the end of the year, we will go through and look at those again, and then we're going to see if we want to kind of tweak those. So if you start with something, and then that's kind of working, but not really working, not really showing you what you want to see, don't hesitate to recreate it so that it is effective and works for you. Now, I will tell you that when we started, I thought, okay, I don't know how we're going to measure this. And so what we did was we gave it to them their first appointment, And then we saw their answers a second time. And so when we saw the answers a second time, we were blown away, me especially, because I had no idea how much change we were implementing into their life. One of the things that we talk about at our center is to listen. You know, if somebody comes in wanting a pregnancy test, we're going to give them a pregnancy test. But if they come in wanting a pregnancy test and they were raped, we're talking about a different situation. Or if they're being abused where they're at right now, we're talking about a different situation. And so we listen. And so when we started getting the statistics off of these simple little forms, we saw hopelessness at first at about 30%. And then we saw they were filled with hope within 6 weeks. And we are at about 92%. And so when you consider it made that kind of impact, and when we talk to donors and we get to tell them that, that's huge for us. And so this one little thing that I thought was, yeah, whatever, has made a tremendous impact on our center. And like I said, make sure that when you try to do this, you know, tweak it to how it's going to work for you. Don't be afraid to change the questions, and don't be afraid to get even more detailed or things like that. We also have a form that we call the How Can We Make It Better? And I promise I won't take up all the time. How can we make it better? And that form, we ask them, you know, basically, how did we do? We had a lady come in the other day, and she had a really, really sweet, adorable little girl. And that little girl is probably about 18 months. And so, okay, granted, we are really baby lovers, but she came in and this little girl was so sweet. And so on her form, she put on there, I love the way the staff interacted with my child. She's not welcomed everywhere. And I thought, are you kidding? We were trotting her around the place. Did you see her? And again, it just showed us that spiritual impact and making sure somebody feels loved and cared for, and that baby is important and beautiful. It makes a difference. Go ahead.
No, I think those powerful stories are really why we kind of came up here. I mean, it is amazing. When we first kind of started along this road, it really dovetailed into what we were already doing. We look at being trauma responsive, trauma informed. We have a million evidence-based, assessments, things like that. Who doesn't love an evidence-based assessment? But it was missing something. And what it was missing was really that spiritual questions, that hope, that role satisfaction. Are you satisfied with your life? We're sitting in front of teens that we're thinking, are you hopeful? And they're like, no, I'm not hopeful. It was a deeper conversation, these few questions, and ours have kind of the smiley faces on there also. And we looked at not only just their hope, but their resiliency, those protective factors. We kind of wove those questions together, those 40 assets, that one person they have in there. And so we started to see that they weren't satisfied with their life. And so we got to have a deeper conversation, whereas not that those evidence-based questions don't get those deeper conversations, but we could talk to them. And the one that really stood out to us was we had a father that we were meeting with. We had done all of our intake, all of our questions, and we brought out the hope and resiliency, and he just circled that he can't get through hard times, that he's not hopeful, that he's not satisfied with his life. And the staff stopped and said, what's going on? This isn't, everything else, yeah, this is good. I'm good. I love a dad that's always good. I'm good. And he just said, it's not there. I don't know. I don't feel that way. And so we were able to have that deeper conversation and actually talk to him about his mental health and his role satisfaction and what he had to offer and some of those strengths and some of those things. And he just lit up, and we were actually able to get with his mom and connect him to mental health services so that he could deal with some of those depressions, some of those things. And so it was really interesting to think that these, questionnaires, I was like, okay, we got this. We got hope and resiliency. We're going to get this in there. But it gave a deeper impact. And it really went with that safety in that relationship. That's what that is. It's not locks on doors. It's what you all offer, it's that transparency, that trustworthiness. It's what really matters in those relationships. Even in those 5-minute phone calls you have, it was just really amazing to see. So, thank you.
Oh, yeah. I agree. I concur. Yeah, wonderful stuff. I don't think there is anything more important when you're working with families. And this is why every single thing we put out is positive, it's empowering. We, more than anything, want to create within families that, yes, I can do this. We're going to explain how to do this in a really easy way, and you are going to be able to do this, whether you're a direct service provider going through training or a family. But we have woven those questions into our Choices Today, Option Tomorrow program. That program is insane. It is 8 sessions of pregnancy prevention. It has taken off like wildfire. And I think a lot of the reason it has taken off like wildfire is because we're doing a lot of this type of work in there. We're really talking to middle school and high schoolers about their plan for the future, how they handle issues, developing that resiliency within them, helping them see that they can have a future that doesn't involve a teen pregnancy, and that, guess what? You've got control over that. It's the choices that you make today that will determine the options that you have tomorrow. I actually came up with that name, and I'm pretty proud of it. I have 7 kids, and that's actually something I've said to my kids for years and years and years, is that your choices today determine your options tomorrow. That and every action is either opening a door or shutting a door. And then when they do something wrong, I'm like, did you hear that? That's a door slamming. You just shut that door in your future. So yes, I'm also very much in favor of how do we look at building this in, and then how do we look at measuring it? Because I agree with you, it's tricky. It's a tricky thing to measure. So it's exciting to me to hear about successful measures that have been developed on this. Do we want to answer questions?
Yeah.
Yes.
If there are any questions, I would like to ask you guys, if I'm cutting.
Let me just, logistics, the mic is broken, so we can't go around and help you, so you're gonna have to yell your question really loud, and then Cameron's gonna have to
We can repeat it.
Okay.
Yeah,
And we
we'll
will
repeat
repeat
the
it.
question. Yeah.
One of my questions for you is to ask about your questions. How did you come up with the questions that are appropriate for you to ask your clients? And what do you do when you get an answer? You kind of alluded to it, but if you get a red flag answer, so if you could each talk about how you came up with questions and or are evolving with those questions, because I think that's would be
Yeah.
helpful.
And, sure, you can go first.
It doesn't matter. One of the things that we did was we wanted to make our questions, just like on our first sheet. Currently, I feel I have people in my life that will be supportive no matter what decision I make. So right there would tell us if they're going to walk out friendless, okay? Because believe it or not, we are finding more and more people have no one. And I mean no one. So when they finally get past whatever trust issue they have, then they will actually start talking to us as if we are friends with them. And so we went through, I currently feel peaceful, nothing, overwhelmed. And so then when we decided to do the other questions, we decided to make them easier to answer. So again, just so it's not like a yes/no thing, I do feel this, or I don't feel that, or I feel this right now, but I don't feel that tomorrow. We just kept tweaking it. That's how we did it. Okay, go ahead, Libby. Sorry.
Oh, no. So when we looked at our questions, really the same thing was knowing the population we're kind of, working with, things like that. We also looked at So the medical field has really started to look at that spiritual health. So we looked at some of those questions that are asked in little tiny increments. So we got kind of some of that information. Brother Bob was there and kind of put us into a few, journals. And so we looked at what were the questions being asked for hope. And just like you said, how can you answer them so that it wasn't, a yes, no, maybe. We kind of have one that says sometimes, ever. But that's where we kind of moved with the faces. I mean, you get that yes, no. You all know a Likert scale. It's wonderful. It's beautiful. But you can kind of have that deviation. So we looked for faces that could more talk about the feeling. And so every other question is more of a hope or a spiritual health question, and then a resiliency. So really looking at just those two things we wanted to see. What I found interesting is I thought most of our teens would be high resiliency and low hope, and they actually came with a little bit more hope than I was amazed by. And so I really like that it was eye-opening, some of the things that you think and all that data we know, and I'm like, this is this answer. I know this is going to be it. It really was just interesting, and also being able to change them and find what works and see how they answer them. So we just looked from kind of a combination of those two things. So.
I just wanted to add that a lot of times they're going to tell you what they think you want to hear too. And so whenever we see somebody who is not feeling any kind of hope or don't have the support in their family, that's where we start. So what brings you here today? What can we do to help you? And the baby thing is down the line, okay? We'll deal with that. But how are you doing today? And if you're not doing well today, why? And it could be anything from my phone died to somebody died to I don't know what I'm going to do now. I have no money to I don't have food. And those open-ended questions, because we started with this, can you tell us why you need help and what kind of help is it that you need? And that's why, again, the resource book that we get is huge, because we can go through it, circle things, because a lot of times when they're with us, they're not hearing everything, okay? And they're not comprehending that there really is hope out there. So we'll circle it, or we'll point it out, or we'll write it on their sheet, or we'll do something so it brings back to their attention. We'll flag it in the resource book. We'll flag one of our trifold brochures. We'll do whatever we need to do so that they know they're not alone, and that's huge.
I could go off of that if you want me to. Okay. I think just saying that, and it's something we all know, is our families they're experts in their lives. You let an expert teach you. And so let them teach you. They want to teach you. And you are amazing listeners and learners, and I think that's what this showed us, and showed even staff, is they are the experts. They're going to tell you what they need once we can lower that defense of what does she want to hear. I'm going to be a good mom. I won't hit my baby. I'll feed it every day. I'll change its diaper. And you're like, whoa, whoa, whoa. How are you not going to hit that baby every day? Because I have two at home that sometimes I look at sideways. I don't, but I'm like, oh. But it's that, and I think it's that normalizing that we all have those feelings, and that we all deal with stress. Who do you have? Who is that person that you get to call at 2 a.m.? And if you don't have that, can I offer you someone? Can I get you somewhere? So it's really, that's what I found really amazing about asking some of these questions, is it created a deeper meaning. And a deeper meaning, I think, in the services and what was being offered, so. Yeah, is my voice loud enough, or do I need to stand up each time? Oh, for pity's sake. This is really working my thighs, people. Okay, so I'm like, whew. Actually, that is a really great question, because it is hard. You're going to have those early adopters that are like, yeah, and then I had several that were like, no, another question here. But seeing the outcomes and seeing the different conversations, that's actually what embedded it. I mean, they were all like, yes, we'll do it. That sounds great. Not that they weren't very excited. But they heard it. And so what I noticed too is it actually started to change like case plans. I didn't even push it. I just was like, let's see. It changed some of the goals they were setting. They got a little bit deeper, not just like get a C in that class, understand, biology, and it became a little bit deeper, like they were having a deeper conversation. And not to say they weren't having those deeper conversations, but I think it allowed even clients to go a little bit deeper, like, oh, we're gonna go on my emotional. I don't have to wait to tell her this isn't all good. So I noticed kind of some of those changes, I'm sure.
Yes, and I echo that as well, but also being able to tell our staff, just wanted you to know that 90% of our clients have walked out of here with hope. And that's huge because they need encouragement. We all need encouragement anytime that we can. And our rewards aren't the normal rewards in a working life. And so when you can offer that reward, it really makes them feel, oh, that's right. It brings them back to what your mission is and what your purpose is for doing all the things that we do. Because the stories aren't pretty. They're not. And so we try to get any kind of encouragement from whatever we can, and this has been one of those things.
One more question of you guys, having read and listened to a lot of people talking about it, and that is that on that initial assessment, frequently people found something that was very troubling to them, a big red flag, and we also have talked a lot about suicide in the community, the trauma and other things. Could you just touch upon that?
Yeah. One was, one of the questions, or one of the things that really hit us was the fact that they have no hope. And the other thing that was really disturbing to us is they have no one. And so being able to even be that one temporarily and to offer hope and to see that mindset change, that was huge for us.
So we have, if anyone circles, the sad faces are lower, we kind of have a scale. We actually go deeper and have a conversation of when was this the last time this happened, and we actually then go into a depression scale with them. So asking those questions, what we know also is just don't, have you ever thought of killing yourself, using those terminology so that we can kind of talk about it and creating a safety plan. So we have had several that, and as I said, and in all of those other assessments, even our EPDS, oh, we're fine, and we would get to this, and it's actually why we've started using it last in all of them, because we see that they're more willing to answer these questions in a different way. So we do a safety plan, connect to, whatever services, if we do need to go, inpatient, kind of those things. So we kind of ensured there was a safety measure in place, as we all do, just when that arises.
Yeah, I would say we're very similar. We're working with youth. Not my work, but the work in the education department is with youth. And so in the programs where, like, for instance, Choices Today, Action Tomorrow, we do a very in-depth pre and post assessment, and there's places where youth can write in, and we've had youth write in that they're considering suicide, that they're being sexually abused. We report that to the school. We have recently really increased, and are increasing even more, our education in the schools on sexual abuse prevention. We had a big, heated discussion when we did that about before we start doing this, there needs to be a plan in place because kids will report. And what do we do when kids report? How do we handle that? And making sure that the schools were prepared for that too, for us to report to them that they had a way of handling it too. So yeah, that is one of the downsides. And the kind of the argument we got into was sort of, well, then we just shouldn't do this. And I was like, no, we should do it. We should just be prepared to do it and be thoughtful about doing it. Because the reality is once you start asking those questions, you're going to get some answers that you don't want to see. And how are you and your staff prepared to handle those answers? So it's some pretty intense conversations and being prepared for that.
Can you tell us where to get more information on the safe, stable, and nurturing? I don't know.
You can go, if you Google CDC, Safe, Stable, Nurturing Families, you will get a 60-page document that covers a lot of what I covered today. It kind of just covers that. There's not a lot of options for you because this is so new. There hasn't really been anything developed like, hey, here, you can use this. That's not there. They're going to say evidence-based programs or Head Start and Nurse-Family Partnership and things like that. So unfortunately, we're on the ground floor of this.
I have another question, Holly.
Oh, yeah.
I pulled up the Babies Love website, but I'm afraid to look because I'm afraid it'll start.
It will. It'll start talking to you.
It'll start talking.
Unless your sound is off, yeah.
Yeah. But can you recommend a resource for the people we're serving that talks about toxic stress and the different levels of stress, the good stress, the medium, the bad, that's appropriate for the audience? Some of those great graphics that Jen created, is there a place that
No.
does a quick video on what that is?
No, but we could do that for you. and that's something we'd like to do, and I've talked to Dr. Sarah G. Quinta, who's very interested in this. So we would love to do those types of things. This is really the direction we're moving in a big way, because,
It's great to explain.
yes, yes.
Some stress is okay, but other
Right.
stress is harmful.
And that graphic is off of the Harvard developingchild.edu site. That graphic is way too, the words are at way too high of a level to use with people. But we can easily develop stuff like that, and it needs to be done. I mean, it does really need to be done. I would love to see it in a paper format, in a short video format, where, because I agree, we need to understand the different levels and where bad things really start to happen. And that's,
And that there's something that can be done. It doesn't mean if you're in
Yes.
toxic that all hope is lost.
yes. A couple years ago it did, but now it doesn't. Now, there's things that can be done now.
It talks longer now. It's
Yeah,
better.
exactly. My talk is way better now. Everybody doesn't leave, in a state of depression and ready to just quit their jobs and find a new career, which is how I kind of felt I did this before. Was there a question back here? Okay, no, thought I saw somebody waving their hand.
Any other questions?
Let's give them a big round of applause.